Okay, so let's go ahead and finish the last activity of exercise 4, the endocrine system physiology, which is titled as measuring the cortisol and adrenocorticotropic hormone. Okay, so what are the objectives? The objectives are: one, to understand the terms cortisol, adrenocorticotropic hormone, corticotropin releasing hormone, Cushing's syndrome, iatrogenic, and Cushing's disease and Addison's disease. Also to understand how cortisol releasing hormone controls ACTH secretion and ACTH, and how ACTH controls cortisol secretion. Also to understand how negative feedback mechanisms influence the levels of tropic CRH and ACTH, and to measure the blood levels of cortisol and ACTH in 5 patients and correlate these readings with symptoms and diagnosis, and also to distinguish between Cushing's syndrome and Cushing's disease. So let's begin. So this is an overall introduction, and here we're going to look at the materials and methods, where we have plasma samples from 5 patients. We also have a high performance liquid chromatography column, and that is used to quantitatively measure the amount of cortisol and ACTH in the patient's samples. So we're going to be using the HPLC, the high performance liquid chromatography, in order to quantify the amount of cortisol and ACTH in our samples. And then we're going to use a high performance liquid chromatography detector, and that is important for providing the hormone concentration that was in each sample. And then we're going to use reusable syringes. These are used to inject the patient samples into the high performance liquid chromatography. And in the end, we will have an HPLC injection port that is used to inject the patient samples into the HPLC column. Okay, cortisol. Cortisol release is stimulated by the hypothalamic hormone ACTH. That is a pituitary hormone, not a hypothalamic. It's a hormone secreted by the adrenal cortex, not the medulla. Release is stimulated by the hypothalamic hormone CRH. Is a hormone important in the body's response to stress. That's very true. ACTH is a hormone secreted by the postpituitary. No, the anterior pituitary. Release is stimulated by increased levels of cortisol. No, is a hormone that stimulates the secretion of the hypothalamic hormone. That's not true. Is a tropic hormone that stimulates cortisol release. Perfect. CRH, release is stimulated by increased levels of cortisol. It's not true. Is a tropic hormone released from the anterior pituitary. No, released from the hypothalamus. Will reduce cortisol release through negative feedback. It is stimulated by increased level of no, has a tropic effect on the anterior pituitary gland. Yes, because it comes from the hypothalamus and it stimulates my anterior pituitary. Check my answer. Cushing's syndrome refers to hypercortisolism, which could be iatrogenic. That's true. Okay. So what does iatrogenic means? It means it is due to medication or due to an illness. Okay, is an illness that is caused by a medication or a physician. That is true. There's hypercortisolism. So C and C. Cushing syndrome is hypercortisolism. A condition of hypocortisolism can result from too much CRH being released from the pituitary gland, and can result from too little ACTH being released from the hypothalamus. Does not release ACTH, it releases CRH. Can only result from an insufficient amount of adrenocorticotropic hormone. Refers to low levels of cortisol. Yeah, that's perfect. Submit. Okay, select the cortisol to prepare the column for the separation and measurement of cortisol. So we choose cortisol. Okay, drag the syringe to the first tube to fill the syringe with plasma isolated from the first patient. So we have filled the syringe with the plasma from the patient number one in test tube number one. Then drag the syringe to the HPLC injector. The sample will enter the tubing and flow through the column. The cortisol concentration in the patient sample will be recorded. Okay, then select record data. So now I have recorded micrograms per deciliter of cortisol in patient number one. Then we clean. Then we clean the column as well. And then we do the same thing for number two, the second patient. Then we put it in the injector. The injector is going to measure for me the HPLC detector, and it's going to record the data. So we select clean beneath the syringe to prepare it for the next sample. Clean the column. Normally, high levels of cortisol would inhibit release of normally high levels of cortisol would inhibit the release of, so cortisol is the product, so it will inhibit ACTH and CRH. Check my answer. The procedure for the remaining samples will be completed automatically. Drag the syringe to the third tube. Okay, let's do that. Okay. We have done up to 3. Let's do 4. Then let's do 5. Okay. So now we're gonna move on to ACTH. Let's put it in 1. Injector. Record date. Clean. 2. Clean the column. And 2. Injector. Record data. Clean. Clean column. Okay, which hormone stimulates the pituitary gland to release ACTH? CRH. Okay, number 3. 4. Last but not least, 5. Okay, so indicate whether the cortisol and ACTH concentration levels for each patient are high or low using the following breakpoints. So for cortisol, if more than 23 micrograms per deciliter, that's high. Less than 5, that's low. More than 23, that's high. Less than 5, that's low. More than 23 is high. Less than 5, that's low. Cortisol. That is less than 5, that's low. That is more than 23, that's high. More than 23, that's high. Less than 5, that's low. More than 23, that's high. ACTH, that's high. Sorry, for ACTH, we have more than 80, that is high. Less than 20, that is low. So, no, that is low. Yes, less than 18, less than 20 is low. More than 80, that is high. And cortisol, less than 5, that is low. Excellent. So 2, for ACTH, less than 20 is low, more than 80 is high. Less than 20 is low, more than 80 is high. More than 80 is high. More than 80 is high. More than, less than 20 is low. Okay. Now submit. We have finished. Now, under normal conditions, if the amount of secreted CRH increases, then a diagnosis of Addison disease is likely. The amount of secreted cortisol will increase. The amount of secreted ACTH will increase. That's true. Under normal conditions, if the amount of secreted ACTH increases, then the amount of secreted cortisol will increase. The amount of secreted CRH will dictate the development of hypocortisolism. No. The amount of secreted ACTH will increase. The amount of secreted cortisol will increase. The development of hypocortisolism. That's not true. The diagnosis of Addison is likely. Yes, because we will have an increase in the secretion of cortisol. The amount of secreted CRH will likely decrease. The amount of secreted CRH will likely decrease. If the amount of secreted ACTH increases, then the amount of secreted cortisol will increase. The development of hypocortisolism. That's not true. Diagnosis of Addison. That would be B and C are the same. So a decrease in cortisol is Addison. An increase in cortisol, that would be Cushing's. The amount of secreted CRH will likely decrease. then if, sorry. I'm sorry. So if, where are we? Under normal conditions, if the amount of secreted ACTH increases, then cortisol will increase. No. The amount of secreted CRH will likely decrease. Yeah, because the ACTH will go up and inhibit, because that is the product of it. It will go up and negatively feedback and inhibit. Under normal conditions, if the amount of secreted cortisol increases, then we will have Cushing's disease, development of hypocortisolism. That's the opposite, hypercortisolism. If the amount of then the amount of secreted ACTH will likely decrease. That's true, because the product will negatively feedback. A condition known as Cushing, not Addison. The amount of secreted CRH will increase. That's not true. It will decrease because it will negatively feedback. Next question. If a hypersecreting pituitary tumor develops, then an expected outcome is a diagnosis of Cushing's disease. Well, I know that an increase. So Cushing's syndrome is hypercortisolism that is primary, meaning that would be like an adrenal gland tumor. But in Cushing's disease, it's secondary hypercortisolism. Like you would have a pituitary tumor. So if you have a hypothalamic tumor, that makes it a primary hypercortisolism. If you have a pituitary tumor, that would make it a secondary hypercortisolism, which is Cushing's disease. If a hypersecreting pituitary, so that's secondary hyper cortisolism, which is Cushing's disease, not Cushing's syndrome. If a hypersecreting adrenal cortex tumor, so now we have I'm sorry. So the syndrome is actually, so a hypersecreting pituitary tumor. If it happens in the pituitary, then that means that is secondary, because the primary gland that secretes cortisol is actually the adrenal cortex. So a tumor there in the adrenal cortex would be a primary hypercortisolism known as Cushing's syndrome. So if a hyper-secreting pituitary tumor develops, then the expected outcome would be a diagnosis of Cushing's disease. Yes, that's true. Hyper-secreting pituitary tumor is a secondary hypercortisolism. That is Cushing's disease. But a hypersecreting adrenal cortex, that is Cushing's syndrome, definitely. It's not a syndrome. It's an abnormal hypoglycemia in the blood. No, it should be hyperglycemia. Abnormally high levels of ACTH due to the tumor's location. No, abnormally low level of CRH due to negative feedback. Yes, that's true. So the cortisol will go up and inhibit the release of CRH. A patient's chart lists the diagnosis of Addison's disease. Then there's hypocortisolism, hypo abnormally low. So there's abnormally high levels of ACTH. So abnormally high levels. So there will be hypoglycemia, and there will be hypocortisolism, and that will be abnormally high levels of CRH, but you would have abnormally high levels of ACTH and abnormally high levels of CRH, trying to feed back into the repairing the problem. Submit. Okay. Which patient would most likely be diagnosed with Cushing's disease? So here we're looking for secondary hypercortisolemia. So that means we need a problem in the pituitary. So now that would be which patient? That would be my. So now let's look patient number. So let's look at patient number 3. So patient number 3 would be diagnosed with Cushing's disease because the levels of the cortisol and ACTH are both high. So cortisol is high and ACTH is high. So that means there is a tumor in the pituitary gland. So the tumor of the pituitary gland secreting so much ACTH, and as a result, you would have so much cortisol. So the tumor is in the pituitary. But if it was Cushing syndrome, you would have normal ACTH or low ACTH, and then you would have really high cortisol because the tumor is only in the adrenal cortex. Question number 2. Which 2 patients have hormone levels characteristic of Cushing's syndrome? So now that means I need only high, very high adrenal cortex cortisol. So I need to have hypercortisolism and low CRH and low ACTH. So I will find that in patient number 2 and 5. So patients 2 and 5 both have high levels of cortisol. So I have high level of cortisol and 2 high levels of cortisol, number 5. And they have low level of ACTH. So they have low level of ACTH and high levels of cortisol. Okay, and then what is the next question? Patient number 2 is being treated for rheumatoid arthritis with prednisone. How does this information change the diagnosis? Well, remember when we talked about iatrogenic Cushing's syndrome? So that means the treatment for rheumatoid arthritis, this prednisone, this corticosteroid, is going to cause this Cushing syndrome, because now I have a primary hypercortisolism. Then which patient would most likely be diagnosed with Addison's disease? So with Addison's disease, I need hypocortisolism. So which one has a low cortisol? 1 and 2. 1 and 4. But in order to have Addison's disease, you see that patient 4 would be diagnosed with Addison's disease because the level of the ACTH is high, but the level of the cortisol is low. So we have low cortisol indicating Addison's disease, but we have a high ACTH secreted from the pituitary gland, indicating that this patient has, patient number 4 is suffering from Addison's disease. Right here, where's Addison's disease? Primary adrenal insufficiency. So in the primary adrenal insufficiency, you would have a problem, a defect with the adrenal gland and the adrenal cortex. It cannot secrete cortisol, but my ACTH coming from the pituitary gland is high and it's fine. So a defect in the adrenal cortex and leading to an inability to secrete cortisol, that's Addison's disease. And then we have secondary adrenal insufficiency. And that is where you have a defect in the pituitary gland. So ACTH will be low, and as a result, without high ACTH, you will never have a lot of cholesterol unless you have a tumor on your adrenal gland, adrenal cortex. While Cushing's syndrome, primary hypercortisolism, is when you have your adrenal cortex itself secreting high cortisol, and there is low ACTH inhibited by this cortisol, negatively feedbacking. And iatrogenic Cushing syndrome, you will have high cortisol, but you will also have low ACTH, but there's no tumor in my adrenal cortex. And Cushing's disease, known as secondary hypercortisolism, you would have normal, you would have high pituitary ACTH being secreted, and high secondary and high um, adrenal cortex secreting cortisol. You click submit, and that should be the end.